in the interest of talking about trust, this meeting is, of course, a part of a series of initiatives or events that we in the Nordic Wellbeing Academy have been engaged in, both with as part of participation in various events in WHO Europe, work with the Danish Life Science Cluster, both directly and indirectly with Rune in the Nordic Healthcare Group, and quite recently also in Brussels, an event where, well, Vincent wasn't able to join, but at least we had the pleasure of having Amanda there. So, but now we are here collectively and are able to share perspectives on trust. And one of the backgrounds for doing that is, of course, that particular element, that there are indeed perspectives, plural, on trust, even though we use it often, all of us. But there's certainly a point to increasing the trust literacy among us, not just the people in this particular room, but in the many rooms that we are in. And as background for that, very briefly, our observation is, of course, that since we have so many wicked problems, and wicked problems are more or less only possible to solve by collaboration, we need trust to be able to do those collaborations to solve those problems. So I would like to give the floor first now, though, of course, to Anca del Rio. And in this case, I would, of course, also ask Anca just briefly to present yourself, and I'll be playing, and this will be completely normal. I'll be playing with the spotlight, so you will see Anca being the center of attention for a while, but don't worry, it'll be your turn in due time too. But thank you so much for coming, Anca, and let's take it away. And also, oh, sorry, as you probably noted, there's a recorder going on, the video recorder going on, and in the background, we also have a wonderful digital friend called Jamie providing the notes. So any other questions, do follow the chat, and Nina will also make sure to follow that. But spotlight for everyone, Anca, please.
Thank you so much, Lars. Thank you so much for the kind introduction, also for the invitation. A pleasure to be here. In a nutshell, about myself, I'm Anca del Rio. I'm a health economist, currently based in Zurich, but I would say a citizen of the globe, as my experience spans across the European region and the US and Australia, as I have served in several roles, most precisely in digital public health and innovation governance. I have been working with prestigious organizations driving digital transformation in healthcare, from various areas or in various focuses. And the most recent one, it's actually my role with the WHO, where I am advancing AI in public health, more precisely addressing health and care workforce mental health with a special emphasis on burnout reduction to a data-driven digital lens, where we actually work to improve resilience and operational efficiency. I have been also a COVID frontliner during the pandemic here in Switzerland. I'm also serving in several boards. I have had 3 startups in the past and worked with many others, luckily. So I had the privilege to learn as well from the private sector and from the public sector, hand in hand, know what works well, what are the pitfalls, and hopefully how can we make it better through the power of building trust, collaboration, and meaningful partnerships between these. A pleasure to be here. And since I'm aligned with Lars, I have been aligned with Lars on this. I said I'm not going for any presentation. We don't want to make this boring. We just want to cut to the chase and open the conversation on building trust in healthcare in general, bringing my perspective from where my expertise lies. And I'm happy to follow Lars' lead in this conversation and provide as much input as possible. Thank you.
Thank you, Anca. And we can then happily then move forward to Felix. And thank you so much for a wonderful wealth of experiences that are, of course, very important. Truly different between the frontline work and the WHO, and with a smile. But WH quarters is a little bit far away from the front lines. So, but that is not the same that a lot of people there, of course, don't have experience from it. But Felix.
Making improvements, Lars.
Yes.
They are making big strides.
For sure. Felix, possibly also another front line, but another type of front line, though, but also from Switzerland.
Yes, thank you very much, Lars. Hi, everyone. It's a pleasure to be here. And I'm Felix. I'm also in Zurich area, actually, and leading some research on the question, what is public trust in the health system? I'm working in the field for over 10 years now. And my project at the moment focus very much on policymaking, governance, how to build trustworthy data sharing systems and trustworthy service system, complex systems. One application here in Switzerland is, for example, the development of data spaces, and in Europe, but also how to build or embed trust building principles in data sharing policy in the European region. I think trust overall is an important topic. We have been working on it, as I said, for years now. Interestingly, when I started, what was it, 12, 13 years ago, it was actually not so much in the forefront of public debate. I think we see over the last 10 years an increase of the term trust being used in the public sphere and media discourse in the English world, and the same also in other areas of Europe. And the question is, why is that happening? On the one hand, I think we can say we see over the recent years unsettlement of societies. On the one hand, we could maybe start with the first bigger European financial crisis in the 2000s. Then we have Brexit, we have migration crisis, we have unsettlements, political shifts to the right, and that all brings uncertainties into societies which are perceived by many as stable. And I think that is maybe one of the underlying developments why the term trust surfaces. And I think in the digital sphere, the area I work in, where we see now digitalization and in the increase of technology, but that is also nothing new. That happened for years now, also in other areas, is increasing complexity in the system. And for some people, trust is a mechanism to reduce such complexity. The belief is that, well, when we cannot understand technologies, when we cannot understand how something works, we then trust the authority, trust the professional, that they know in our interest how that works, and that's how we can use it. So that is maybe one of the conceptual understandings. And now we see that the term is very much used. I mean, we see that trust is used in policy documents a lot. The European Observatory, the WHO, recently focused a bit on the topic. We see that in the European document around the data space, electronic patient records as well, the term is increasingly used, saying, well, that all needs to be trustworthy, and it's used with the idea that trust leads to adoption or acceptance and support, legitimacy. And so I think it is obviously a very big concept, and but we should also be careful, on the other hand, that we also see an increase of the term as a fashionable word being used in marketing and the like. So there's a certain hype around the word as well. But I think we have enough cases where we can say, okay, it's at least worth considering the topic as an important topic. And so that's the work I'm doing. Thanks.
Super. Particularly on the last element, I've been previously, both in terms of elements like responsibility or sustainability, or climate, we've been using phrases like greenwashing, and that sort of, I couldn't help but think, and maybe we should discuss that later, whether we can talk about trust washing, if that is something that some are doing as well.
Yeah, but we see the use in ethics as well. So we have ethics washing. And I think that is something which is used. And we also know from research that obviously also the certification process itself, I don't know, becoming trustworthy to be able to use certain labels in some areas is it's under the marketing budget. And for other companies where I would say trust is part of the core business value in the sense that they need to use sensitive information data, for example, to create value, there's, I think, more an intrinsic motivation to actually be trustworthy, or at least to think about the topic in a more ingrained and deeper way.
Super. But we can move on also to allow Rune to present and then move back for a discussion. But I'm, of course, conscious of the fact, the fascinating element, Felix, the more the trust is mentioned, maybe it's actually the less it actually is there, either in the document or in society in general. Rune, right now your camera's off as far as I can see. No, you're there. It's just the wrong showing. So now I'm adding a spotlight for you, and then moving you, Felix, slightly out of the spotlight. So it's your turn, Rune.
Thank you. And thank you for having me here. Just a brief introduction to who I am. I'm a partner at the Nordic Healthcare Group. We're a consultancy, and we, of course, work within the space of healthcare. Me, myself, as a background, I have a master's in sociology and been working like the most of my careers, both in the public and private sectors in the field of healthcare, innovation, partnerships, and also evaluation and implementation. So I think that's the key role that I've been playing here. And I think I would just like to take you through my perspective on why trust matters, and also how we might think about what trust plays of a role in terms of collaboration and partnerships. So just to begin with the idea of why investing so much time in talking about trust, I think there are some key elements that we need to have present. I think there's the foundation, at least coming from a welfare society as the Danish, that our economic prosperity and even the core of our state is founded on trust. So we have a low degree of control measures, which allows us to provide services more cost effectively. And I think if you can establish those kind of mechanisms, you can save a huge amount of money, and you can also have a better sort of relational-based service provision. So that I think there's sort of an economic aspect of this that translate into to welfare as well, but also a strategic resource. Deloitte did an insight on the S&P 500 and said that there's a significant economic benefit from those who are able to build up trust. They outperform other S&P 500 companies in the US by up to 50%. So I think there's that reason that we can think about. Also, in the rise of the financial crisis, we saw that financial institutions plumped and the erosion of trust caused investors to pull back. So in that sense as well. But also, I think turning to some of the points made earlier on, I think we can see trust plays a huge role in the engagement and burnout within companies. So I think we have a disengagement crisis that we need to look upon, and I think trust plays a critical element. So I think there are multiple perspectives, both economic, welfare, relational, but also sort of what empowers us as people that we need to think about when thinking about trust. But also, as I think, Lars, you mentioned quite briefly in your introduction, the task at hand that we are facing requires innovation and collaboration, not simple procurement. We're looking at improving healthcare, better prevention, better identification and treatment patterns. Now, all of this will cost us an immense amount of money if we just do what we used to do. So we need to think of other ways of interacting, providing service, but also accessible and affordable healthcare to everyone. And I think this is a key issue in why we need to build up partnerships and why we need to build on collaboration if we are to achieve this task. We've been doing some sort of thinking about what is the receipt of a great sort of public-private partnership. And at the very core of it, we see, of course, there's this part about, coming together, having a shared vision and doing joint action. But at the core of that, for enabling a joint action, you need some sort of relational buildup. You need very tangible opportunities to pilot projects together. You need feedback loops, safe learning environments, and an operational framework for actually creating projects and innovations together. Without the trusting relationships, without us being able to actually believe in the competencies and the will of other actors to be able to actually help solve problems, help create new opportunities, we will not be able to achieve neither sort of innovations, growth possibilities, nor better healthcare outcomes. So at the very essence, I think of a partnership and collaboration, we have trust. We've been looking a little bit into the literature on this area to see what are the sort of the ideas around how you might come to get a better understanding and measure what trust looks like. And what we found is that there's a vast variety of research on the sort of more relational capacities, and we see an uprise in psychological safety, but it's mainly within teams and not cross sectors, not cutting across partnerships. Lastly, we have some emerging research on the network capacities, the network areas of how you might measure trust and think about trust. But there's a huge research gap there. What seems to be the case is that a lot of emphasis has been put on procurement. But as I was, my argument at the very first opening statement was that procurement will not be the solution for these type of wicked problems that cut across sectors, where we need innovations to kind of create new opportunities for providing healthcare. So we need to think also about how we might build up this recipe and really emphasizing the more sort of collaborative spaces between organizations. And we've provided a very sort of early stage synthesis on what this might look like. And I think what we can say is that it won't be something you can put on a very sort of stringent formula and go, well, now we've measured trust. It will be an ongoing process that needs to be reaffirmed, and it can only be reaffirmed through joint action, and needs sort of a cyclic point of view to actually evolve over time. Now, coming from a Danish context, we often hear that trust is something that needs to go before you can have the joint action, the collaboration, and the output. And I would argue that it's different. You can come from multiple different geographical and institutional backgrounds and still come together around joint platforms and create trust while doing that. Now, it may look differently, and it may have a different sort of ways into to getting to this partnership collaboration space. But I think the key message here is that trust is something that can be built along the way. And I think we have some nice cases. Perhaps all of us would know of cases that kind of underlines how this may be done. And I know the WHO are actually looking into how might we foster more of this sort of innovative collaboration, public-private partnerships in actually providing better healthcare to everyone. Thank you.
Thank you. And I'll now just try to bring us. You'll notice that I'm playing with the spotlight again. That's me trying to also do my basic TV editing role on the fly. I will be diving a little bit into that later today as well. I saw Amanda nodding through during your presentation, Rune. The point about trust being built perhaps while we are laying the tracks for something, and instead of waiting for the prerequisite amount of trust to appear before you act could be a fallacy. I know also, though, Felix, that you've been studying the element of using trust as a scapegoat maybe for conveniently not acting. What would be sort of then is it simply a wrongful assumption, or is it well knowingly sometimes that we use trust as a reason for not acting?
No, I wouldn't say that not a reason for not acting, but I think what I see sometimes is that it seems that it is easy to agree on that trust is an important topic. So we can cover a lot with those discussions and basically discuss issues of trust for a long time without sometimes, I think, doing something. Because in the end, what we should know or consider is, when everything is going fine, nobody talks about trust. And I think in the end, it's about experience. It's about positive experiences. That's how trust is built. And if the services in the system work from a public perspective, then I think there's no reason to talk about trust. I mean, and the other way around, when they don't work, then we should look at why they don't work and try to provide good services. And then I think also the issue of trust is not so much discussed anymore. But at the moment, we see that especially in those digitalization efforts, exactly, there's a lot of focus on trust without actually being able to show how those things work in practice. I mean, electronic patient records are a good example in many countries. I mean, there's a lot of discussion. Yeah, they're not used because of trust issues and so on and so forth. But it's not even possible for a citizen to experience the benefit. So I think that is something which should be considered, that it's sometimes really down to practical examples, and that is something which I think is equally important to consider.
I would guess, though, you might say, Anca, that you've experienced in your work that trust can take different shapes as well, in the sense that there's Felix and Rune both referred to the element of trust in digital transformation. Of course, that's something that you worked with quite extensively as well. But it's a different kind of trust, or maybe it's a different strategy for trust when we're talking about interpersonal relations and when we're talking about system-wide uses of trust. What is your perspective on how you might either be able to use some of the same and how you should be mindful to not use sort of an over-assumption about trust being of the same kind, regardless of where you use it, maybe?
Thank you, Lars. This is a very good question, and thank you also for creating the bridge between Felix's experience and perspective on this and what we're currently working on. What I think it's that trust is a cornerstone of healthcare, right? When we talk about building trust in healthcare, we see it as a general or more like a systemic approach. But when we take a deeper dive and when we look into trust, we see the different angles that the trust can be actually approached from. And one that is particularly overseen at the moment when we talk about innovation, digitalization of healthcare, digital transformation of healthcare, it's actually building trust in technology, but from a healthcare provider perspective. This could be, or it is seen as one of the reasons why the adoption of digital tools in healthcare may be slower than in other sectors. It can be also another reason why it can be faulty and could lead to creating even more distrust. And it's actually the same, it has the same level of relevancy when we say that patient trust the providers to make the right decisions, and then providers have to trust the systems to deliver accurate insights. And by that, it's actually trusting the means that are put in their hands and at their disposal. When we envision a certain technology coming into a hospital, it's not enough to just buy technology as it happens in other fields, but it actually needs to be a meaningful adoption in the background. And we see in several health systems this happens more systematically, not systemically per se, by using HTA in hospital setting, for example, looking into the technologies that are being adopted as at bedside, so to speak, and how are they actually being or becoming cost efficient over time. And this is another way that we can look at it. But what is the most important here is building capacity in terms of digitalization of healthcare at healthcare delivery level, but not just by importing technology. It's not like in other fields where you can always benchmark with what the neighbor is doing. Each hospital is particular, and each department in the hospital is particular. Each medical practice is particular. So it really needs to be tailor-made, not the technology per se, but the adoption of that technology. And that involves a very complex process in which the first and foremost important thing is to have the healthcare personnel, or the health and care workforce, how we call it, ready, trained, open, and with the proper understanding, the proper digital health literacy, to be able to put that technology into practice and to make the most of it. In that sense, you don't only get your return on investment as a health system, or in that case, I mean, in Switzerland, it's quite often, right, is private health. So they really look at the return of investment from different perspectives. But in the end, it's highly relevant, because then you know where you can invest your money in order to deliver also better outcomes for the patients, and that are in better hands for health and care professionals. And last but not least, why is this so important? Building digital health capacity with the health and care workforce at hand. It's not just about training them, it's about creating technology with them, and it's about getting feedback from them. When we talk about patient-centered innovation in healthcare, we always put the patient in mind. And we have seen that there are initiatives all around the world, starting from the startups approach, that have been doing that for years now in a very good way, and have taught health systems how to do it better. But we sometimes forget, or as I said, we oversee the element of healthcare practice, of the healthcare practitioners, that they should also be part of the innovation if you want them to use the innovation to be on best hands. We look at the massive shortage of healthcare professionals, and we talk about AI. Well, let's not say replace, because it could create the wrong concept around it, but it would be supplement their work and support their work into delivering faster, more accurate results, and helping where there's actually a lot of gaps right now. But how can this be implemented if not hand in hand with them? So it basically means digital capacity building with the health and care workforce hand in hand, not just in mind, and not just by importing the technology. And I think this is something that could definitely propel trust in healthcare from a systemic view.
Luckily, we're going forward towards also some technological solutions. But I suppose before we round up or wrap up this part of the conversation, also a basic question that was also raised by a good comment from Amanda in the chat. The times we're in are something not just about the digitalization in itself, but it's something where we have identified, maybe quite rightly, that there's a need for interdisciplinarity to find the solutions. I'm not talking about, in this case, collaboration per se, but about the integration of different types of disciplines. But that means working with people that you don't know or that you haven't collaborated with before. So in the nature of that, a brief comment maybe, while Alejandro maybe can start sharing his slides. Rune and Felix, is it completely natural in the sense of us being exposed to now new people that we haven't worked with before, that we become more conscious of trust.
So just to start off with, I think I just wanted to touch a little bit upon an earlier point about the idea of trust being sort of a deficit that we enable us or makes us not act. I think all of us have trusting relations in our sort of social ties that are very close to us, right? We also have projects within our organizations and teams that have really been generating trust. I think what's difficult is what you're talking about now in the interdisciplinary context where we are confronted with other types of world views, multiple interests, because we're also talking about innovations that cut across organizational borders. And I think we should not confuse legitimate questions around our capacity to work together and our competencies with distrust. So just a point being that I think a trusting collaboration entails the ability to actually raising problems and tough issues and to ask each other for help in difficult situations, but also to require competency, I mean, we want a healthcare system going forward that is based on evidence. At least I feel more safely and secure when I know that what I'm being treated with is actually being asked to be documented, and we need to know that these innovations actually work. So there is a process along the way in building trust that also has an inquiry sort of angle, or will also be challenging us to think about whether what we are achieving together is actually achieving the results that we're hoping for. So trust, I think, is not something that we can only view from what we know from our personal life as, you know, the love for my children or the love for my near ones. It has to also have, in the professional domain, cutting across arenas, it has to have a sort of a platform where you're able to ask questions and where you're able to figure out ways of working together. But if you go into this kind of space thinking there's no trust and there's nothing to build on, of course you're doomed before even starting. So there is this sort of dialectics of actually being critical but also do it in a manner where I respect other points of views, but also have the opportunity to explore what am I missing from my point of view. So I think there's this kind of dialectics that we need to think about when we talk about this type of disciplinary trust.
Cool. A final word, maybe, Felix. So if we summarize Rune's comments, we can say that when we're talking about trust, it's actually also because we love each other.
Well, I would say, coming to your original question, I mean, for interdisciplinary work, I think it depends also on maybe how experienced you are. I think the work we are doing in our field is always interdisciplinary and it's natural to our research group and everything. So, and with more experience in that, I think it's easier. Trust is shared by common experience, common positive experiences. So it takes a while. We all know that from our private life when we build up friendships, and that's almost the same, I think, in the work world, at least on collegial level. It takes time, but we also know that when you have higher levels of self-confidence and positive experience of previous positive work relationships, you're more inclined, obviously, to go into a new relationship with an open mind and trust, maybe more inclined to place trust. So I think that is, I think it's part of our modern work world, and what we see often why it's not working, it might just be like very cultural, different habits, etc. So yeah.
So thank you, the three of you. We'll be moving on.